Hi, my name's Ken Stuber. I'm a chiropractor and research faculty member at the Canadian Memorial Chiropractic College, as well as a PhD student at the University of South Wales. Thanks for taking part in this study. This is the main component of my PhD project titled Assessing Patient-Centered Care in Patients with Chronic Health Conditions Attending Chiropractic Practice, a mixed method study. This presentation is a training manual for those working at clinics involved in the project. To introduce you to the study, our aim is to determine to what extent chiropractic patients with chronic musculoskeletal conditions perceive the care that they receive to be patient-centered. This topic has been largely unexplored in chiropractic research thus far. The study consists of two components. First, there's a questionnaire component completed in the office where patients and chiropractors each complete different questionnaires. There's also a separate interview component consisting of individual interviews with chiropractors and focus group interviews with patients in a few locations across the country. By now, you've hopefully received your study package from the courier. The package contains a study box, 65 patient study packages, each including a study information sheet, consent form, patient questionnaire, and 2 envelopes, 5 chiropractor study packages, each including a study information sheet, consent form, a chiropractor questionnaire, and 2 envelopes, some promotional posters, an accordion folder, some pens, and a paper copy of this training manual. Now we should cover which patients are eligible to participate in the study. To be included, participants must be adults over the age of 18 years, able to read and speak English. They must have seen the same chiropractor at your clinic at least 3 times, and they must have a chronic musculoskeletal condition. For the purposes of this study, a chronic condition refers to conditions lasting 1 year or more, and musculoskeletal conditions are those affecting the musculoskeletal system, including but not limited to the bones, joints, musculature, discs, ligaments, and tendons, and that have resulted in signs and symptoms or required treatment. Examples of relevant conditions include spinal pain or injuries such as back or neck pain, injuries to the limbs, including the feet, ankles, knees, hips, hands, wrists, elbows, and shoulders, or temporomandibular joint or TMJ conditions, patients with headaches of a musculoskeletal origin, or patients with degenerative conditions including arthritis or fibromyalgia can also be included. Potential patients will be excluded from the study if they are under the age of 18 years old, are not able to read and speak English, have only seen the same chiropractor at this clinic once or twice, are only being treated for a new condition or a re-aggravation of a previous condition, or if they don't have a chronic musculoskeletal condition. So when you get underway with the study, at the beginning of each day, we ask that you review the chiropractor schedules for potential participants. When the patient gets to the clinic, please tell them about the study when they come in and make them aware of the promotional poster if they haven't seen it already. We'll see that on the next slide. Then ask if they are interested in participating, and if so, provide them with the study information sheet to read over. If they can't finish reading it before they go in to see the chiropractor, they can finish going through it after their treatment. So this is the promotional poster for the study. You've been given a few copies of it in your package. We suggest that you place them in noticeable places in the clinic, such as on the front desk and in the chiropractic treatment rooms, but it's up to you, wherever you feel potential participants will be most likely to see it. After the patient has seen the chiropractor, please ask them if they're still willing to participate in the study. Ask if they need to finish reading the study information sheet. If they're still willing, please provide them with the informed consent sheet and questionnaire package to complete. When they are done, they should place each of those in a separate provided envelope and seal it themselves. Please be sure that you witness them signing the informed consent sheet and that you also sign in the appropriate location on that sheet before they place it in the envelope. This can be done by either chiropractors or the office staff. This is extremely important because if there's no witness to the signature, we cannot include the data in the study. After that, collect the sealed envelopes with the completed forms and place them in the provided accordion folder. Please be sure to store the accordion folder and all completed questionnaires in a secure place, such as a locked filing cabinet or locked file room when not in use and/or overnight. So just to again go over what might be involved for patients if they participate in the study. First, if they are willing to participate, they will read the study information sheet. They can then ask the chiropractor about the study during their visit, and after their visit, if they're still willing to participate, they should complete the informed consent form and questionnaire, make sure they have the consent form signature witnessed, and place them each in a separate envelope and seal them. The questionnaire should take less than 10 minutes to complete. Some patients may be willing to take part in a further component of the study, the focus group interview in particular, but that will not involve you or your clinic. Here we have the participant information sheet on the left and the informed consent sheet on the right. The participant information sheet is 5 pages long. It provides detailed information on the study and what will happen to the information provided, any risks to participating, etc., etc. The informed consent form is 1 page long, and as mentioned, we require signatures from the participant and a witness. Here are the first 2 pages of the patient questionnaire. The patient questionnaire is 5 pages long and consists of 4 parts. This first part is 2 pages long and consists of 11 demographic and health information questions. The next part is an instrument called the Promise 10 GHS. This asks 10 questions about global or general health. Part 3 is an item that allows participants to provide their first name and contact information if they wish to participate in focus group interviews in the future, although this is optional. And finally, we have the Patient Assessment of Chronic Illness Care, or the PACIC. It consists of 20 questions relating to patient-centeredness, and we've modified it to be more suitable for a chiropractic setting. Chiropractors at your clinic will be asked to read the participant information sheet and to complete the informed consent form, as well as a questionnaire for chiropractors. Again, the informed consent form will need to be witnessed, and place it and the questionnaire each in a separate envelope and seal them. The questionnaire, again, should take less than 10 minutes to complete. Chiropractors will also be invited to take part in individual interviews, either over the phone or by video conference, to gather their insights. But again, this is voluntary. The questionnaire for chiropractors is shown here. It's 3 pages long and consists of 7 demographic and practice information questions, shown here in yellow. Following that, there are another 18 questions, which make up the Patient Practitioner Orientation Scale, or PPOS. The first few questions are highlighted here. Coming close to the end, here are a few frequently asked questions that we are anticipating. First, has the study received ethics approval? And yes, it has, from both the University of South Wales Faculty of Life Science and Education and the Canadian Memorial Chiropractic College's Research Ethics Board. Next, how many subjects will we be recruiting and for how long? We are asking each clinic in the study to recruit up to 65 subjects. Based on our pilot study data, we anticipate that this will take 6 weeks or less. Finally, how will the finished materials get back to the study team when the data collection period is over, or when you've finished asking patients to participate? And we just ask that you please add all materials to the study box and courier it back to the study team using the study team's courier account. Thanks again for being part of the study. I truly appreciate your time and assistance. If you have any questions, please do not hesitate to contact me at the email or phone number shown here. We'll try to be in touch with your clinic prior to launching the study and once a week during the data collection period, either by phone or by email. Thanks again.